Oh, here I am live. Hi, it's Rita at Travel Nurse Channel, and just seems like ages since we were live together, and it's just been a week. So last week is behind us now. My friends are coming along, and we got through some things and a funeral, and so here we are live again, fortunately. And we will be live again on Thursday from 2 to 3 Pacific Standard Time. So I'm Rita. I'm a longtime nurse. I graduated in the 70s, 1977 to be exact. And I've had a long and varied and wonderful career as a nurse, and employed a lot of nurses at one time, and coached and counseled and administrated and was clinical, I would say, for probably as long as I coached and counseled. And so I am focusing mostly on the need for travelers, the experiences travelers have, and those who need travelers, from the skilled facilities and long-term facilities on up to the most acute, the heart hospitals and so forth, and everything in between, clinics and oncology units and surgery centers and et cetera, et cetera. And we use travel nurse experiences and information, but when I refer to travel nurse, I mean all travelers in the healthcare field. That includes allied and technicians and therapists, etc. Okay, so today I thought we'd look at things from the client perspective, and the news is good. From the client perspective, the response, the HCAPs, and the response to utilizing, oh, feels like something went out, but maybe not. The response to using travelers is a positive one. So it impacts them positively. And the reason being is that bringing in travelers, so rarely is there a traveler with less than a couple of years of experience. In some cases, they will bring in a traveler with 1 year, but there's a lot of criteria involved. And so, and the choice to be a traveler is, not one to be made lightly. And so you really kind of want to feel well-grounded in your skills and have that experience before you start to travel. With some of the specialty areas, intensive care, cardiac, labor and delivery, emergency room, and so forth, particularly with the COVID and so forth, they are usually looking for 2 or more years of experience. And I think that most travelers worth their salt are going to want that strong background before they venture out. I didn't do traveling. I wish I had. I employed travelers and I counseled travelers. I did a lot of per diem and became comfortable with it, but not initially. My husband kept sort of coaxing me because our children were small and I'd have a more flexible schedule. I could be available, when we had good childcare and so forth, and he could back me up on the weekends and so forth. So I went into it kind of with a lot of trepidation because my work life was always like a home away from home. Well, what happened is I did try it out. Oh, hello. Hello, may I know what quality are the basic for the nurses? So this is, I think it's Dr. Raman Moxler. It's coming in, it's sort of fading in and out. Hello. This is the thing about when I'm streaming this video on Tuesdays and Thursdays and it's live, you can ask questions. So let me get a sip of water. And so MD Raman is asking, how may I know the quality of the basics for the nurses? Okay, so nurses and or any traveler that is going to travel for 13 weeks is average. It can be more, it can be less, and a contract is signed and these things are decided. The nurse will be a graduate from an accredited school. The recruiter or the hiring manager who brings in this traveler will have checked their graduation status, check their license in the state they're coming from. So say the traveler lives in Florida and they're traveling to Chicago, or they live in New York and they're traveling to California, or they live in Oklahoma and they're traveling to New York. What happens is this nurse will have to apply for a temporary license for that travel, time of travel. And so whoever is doing the research to bring the traveler in, it could be a recruiter, you could be working with a company, or it could be directly from the employer, the hospital, the long-term, the clinic, and so forth, the doctor's office. They will want to have a lot of pieces in place before they bring in that traveler. They want to know that that their license is in good standing. They want to know that they came from an accredited school of nursing, that they have experience, that they have no health issues themselves, that they're healthy without work restrictions. Why is this blinking on and off? Oh, okay, here we go. Here we go. Dr. Rahman, may I know what quality are the basics for the nurses? Okay, there you go. So now, how do I move that back? Okay, so they have to be healthy and no work restrictions and have all their vaccinations. They have to be experienced, minimally 1 year, usually more. And they have to be experienced in the area that you're bringing them in to work for. And that would be, good to use a little Kleenex here because I always get a little itchy. Okay, so you wouldn't bring a labor and delivery nurse in to work in the ICU, for example. And you wouldn't bring a telemetry nurse in to work in labor and delivery. So you really want the experience to be like experiencing. So that's it. So whatever you're bringing the nurse, if you're bringing in a nurse to work in the operating room in your surgery clinic, you want a nurse with at least a year or two of that particular experience. And all of these, all of the paperwork needs to be reviewed, all of the physical credentials, not the credentials, the physical, a health physical within the last year, a tuberculin test within the last several months, maybe 6 months. Now COVID would be an issue. They would have to be COVID negative, not maybe even have antibodies, you know. So all of these things have to be in place. You need this experienced nurse that meets all the criteria, is healthy and ready to go. And then you sign a contract. What is that contract going to look like for 13 weeks? So they're going to work 5 days a week for 8 hours, or 12 hours, 12-hour shifts, 6 in a pay period, etc. So it would be something like that. Is it going to be nights, days? Are they going to be flexible? Are they going to flex to days and nights and so forth? So these are the things, right? If you need a pediatric nurse, you don't hire a labor and delivery nurse. You need a nurse with pediatric experience. And that's usually, that's the basics, you know, a nurse with experience, with the right license, and you check both licenses. So if she's coming from Florida to work in Chicago, she will need to get a temporary Chicago license through the board in Chicago. That takes minimally about 5 weeks. So, so you have to plan ahead when you need a travel nurse. I think during COVID, they were able to do things a little quicker, and I know nurses, a lot of them went to New York because New York was in such terrible shape, and so some special compensations were made or concessions were made to make that happen. And but the basics are to be from an accredited school, to be experienced, to have all your credentials, your basic life support, advanced life support if necessary, the special credentials you would need for labor and delivery, the special things you would need for the emergency room or pediatrics. That's it. That's what it takes. And then there's usually interviewing. The interviewing is often a Zoom or a phone interview. The paperwork goes back and forth over the airwaves, over the emails and so forth, and that's how it happens. So back to the focus of today, and thank you so much for asking a question, Dr. Rahman. The travelers of today are actually, with their skills and experience, are having a positive. They're positively impacting the facilities where they go, the hospitals, and they're not only having a positive impact on the patients, but on the hospitals as well. And the hospitals, my research is, when I research for the hospitals, I usually go to Becker's Review. They do hospital reviews all the time. They have great updated information all the time. I often go to the Center for Disease Control, the U.S. Centers for Disease Control. They have good information. I go to the Academy for Nurses. There's different ones for med-surg and the different nurses. So I pulled this information, and it came up with some really good news, is that that bringing in a travel nurse has had a super positive impact on not only the well-being of the patient, but the well-being of the hospital. So I keep losing my contact information. And so, so what is happening? These nurses, they provide their experience and their level of confidence and their skills, and they impress the other people they work with. They impress the team, the doctors, the nurses, the techs that they work with, and they impress the patients and the patient's family. And how do we know this? Is from the HCAHPS. So it's a consumer. The HCAHPS and the CAHPS, the CAHPS, are they're a tool that is used to evaluate the patient's satisfaction. And it's not just the satisfaction with how they came through the disease process, but how happy they were with the care. Did they feel they were cared for? Did they feel people were listening? Did they feel comforted? So there's a whole battery of things in these HCAHPS and that tool that is used throughout the United States. And I'm going to quote something. This is from the Becker's Hospital Review, and it's fairly recent. And they said, the use of supplemental nurses. So a travel nurse is a supplemental nurse. A per diem nurse could be a supplemental nurse. It's someone that is outside the regular staff that has been brought in to assist. So in quotes, the use of supplemental nurses is a sound strategy for medical institutions to employ to maintain appropriate nurse to patient staffing ratios, to promote patient staffing levels, and to ensure high levels of patient satisfaction and patient care. So that's what's happening. So I thought, you know, we're talking about, oh, what's it like to travel and figuring out where you're going to live and so forth. But the actual work you do has a huge impact, and it's a positive one. So I wanted to point that out. I'm not sure I read that quote very well. The use of supplemental nurses is a sound strategy for medical institutions to employ to maintain appropriate nurse-to-patient staffing levels and to ensure high levels of patient satisfaction and patient care. Okay, it's like a big long sentence, and I wasn't sure if I portrayed it clearly. There's somebody else checking in. I'm curious how the rehabilitative professionals are doing now. Is this still essential with all the distancing from COVID? I'm trying to become an OT and I want to ensure that it's a needed career path. Oh, that's excellent. That's excellent. Well, okay, so yes, the rehabilitative professionals, the PTs, the OTs, and the CODAs, the Certified Occupational Therapy Assistants, and the PTAs, the Physical Therapy Assistants, and the speech pathologists, and all of these groups of rehabilitative professionals can, very similar, can and do travel for assignments, whether it's home health, education in the school systems, or in the hospitals, or in the long-term facilities. There's still a need. Yes, there have been cutbacks. The strongest cutbacks have occurred in the acute facilities, and it's temporary. It is a COVID situation. So what's going to happen? The rebound is that the need will be even stronger. So no worries there. The rehab, thank you very much. That's coming from Alex Brooks. Thank you for tuning in. And I hope that helps. And good luck with your career path. And yeah, it is, the need is strong. It's there. It's there for the students from pre-K all the way up to college level even. But for the most part, in the preschool and the elementary and high school level, that need will be there. It will continue to be there. In the outpatient setting, it will continue to be there. In the acute setting, there's been a little bit of a lull, a little bit of a cutback. The hospitals are catching their breath after COVID. I know in Southern California, we're still dealing with the impact of COVID patients. What happens with the COVID patients, and I want to interrupt myself and say thank you. Thank you very much to all the travelers and to all the caregivers in all of the hospitals across the nation that are taking care of COVID patients. It is a lot of work. It is heart-wrenching work. The patients that arrive are usually very sick and continue to be very sick, particularly the patients, the immigrants that we take care of. They have no address. Their conditions are not good. They're often diabetics. Sometimes they have addictive problems, hypertensive, maybe respiratory problems, and they haven't had a lot of health care. And they arrive in very poor shape, and everything is done. Every patient that arrives in a hospital here in Southern California is treated with the utmost respect and care. And it could be weeks or months. The average symptoms can be anywhere from weeks to months. An average is 120 days. So if you've been ill and hospitalized, there is the possibility that the virus can have an impact on your health, not just in the initial stage, in the acute stage, with the fever and the oxygen levels dropping, but you can have illness and discomfort for as much as 120 days. So it is quite, it's a virus we've never seen before. It really has a terrible effect on the people that are ill, and it is very tough for the caregivers. So thank you. I want to move away from that and get back to the subject at hand. There's another comment here from someone anonymous. Do different companies have different contracts? Yes, it varies. There are some, and that's why you need to do your homework. And we've actually had episodes where that is discussed at length. Let me go back to some of my notes. There is, and here's another question. Yes, okay, so we'll get to that question too. Okay, so do different companies have different contracts? Yes, they do. There is some similarities. I mean, the onboarding, the preparation for travel is going to include some of those basics that I spoke about. They have to have a valid license in the state they're coming from. They have to have applied for and received a license in the state they're traveling to. And there are some compact states like Arizona and some of the surrounding New Mexico and so forth. There are some compact licenses that include more than one state. So it's possible if you live in one of those compact states like Arizona, you can probably travel to New Mexico, whoever's included in your compact license. So there are compact licenses that include more than one state. So that's something. You may travel, you know, a lesser distance and work under the license that you're currently carrying. Otherwise, you do have to apply for a license, and whoever is doing the review and preparing you for that travel, oftentimes a recruiter or a recruitment team, they're going to check both licenses, that they're in good standing. Valid, active, and in good standing. And the difference in the contracts may be rates or, you know, one maybe say you want to travel to Florida and one hospital's contract is just for the Tampa area, you know, West Florida, but another company services other areas, Fort Lauderdale, Miami, different parts of the state. So the contracts will vary in as far as who the recruiting company does business with. So there's very specific companies that work specifically, say, with long-term, specifically with LVNs and CNAs, companies that work with techs primarily, or techs and nurses. So, and other contracts, they're going to vary a little bit in how they disperse the monies, what their relationship is with the hospital, but there will be similarities. And what I'm hearing when I talk to the nurses on the nurse end of it is that they want ease in communicating. So they often will follow the recruiter as much as they will follow the company. So there are bigger companies, smaller companies. It depends on what your needs are. And so the contracts will only vary minimally. You're still going to have those active licenses and credentials and a physical and drug testing. I mean, those are real basics in hiring. And so I think what you're looking for, if you're on the nurse or tech or allied end of it, is efficiency in your company and good communication. Okay, so this other question is coming from somebody with, I hope I don't mess up the name, Mokesa Khatun. Khatun? I'm not sure if I'm pronouncing that correctly. And they're saying, hi, in extreme situations, how do nurses handle the pressure, for example, COVID? And I guess it's going to be an individual. It's going to be an individual basis. When you go on a travel assignment, the hospital or the long-term facility, wherever you go, kind of has you under their umbrella to a degree. In other words, you're treated like a staff member while you're there, even though you're a traveler, you're temporarily there. So you will be probably, and I'm saying probably because every facility is going to function a little differently. I'm going to get a little more fluids here. So it depends. Is it a bigger institution, a smaller institution, and so forth? And this is something you can talk to your recruiter about before the assignment starts. Just say, and the biggest support, I will say, is your recruiter. And that's why you want a good recruiter. Many companies have clinical support. And so if you're looking for some special support, you know, whatever it could be, you know, it just could be counseling, could be, I don't know, maybe your exposure was high, or your PPE, your personal protective equipment was didn't meet your standards and so forth. So if you have these types of questions, You go to your recruiter, you go to your clinical support person, and you tell them what's bugging you. Or if you're just tired, I mean, if you do 3 12s or, 5 8s in a row, and, you have 2 to 4 or more COVID patients at different levels in their process. Some are very sick. They're on the rotor beds. They're getting all kinds of oxygen, and it's not working, and they're dropping into the 70s and preparing them for intubation. These are dreadful things. These do take a toll on even healthcare workers. We're humans, right? So, and then the situation with COVID, in addition to all of that, is they don't have their regular support. The patient doesn't have their regular support because family members cannot go into the institutions. My mom is in a senior living. It's a type of institution. She lives very well. She has her own apartment, and meals are made, and housekeeping and all that. But she hasn't been out in 6 months. We have to visit her through a window as though she were in prison. So all of these things take their toll, and we all need as much support as we can get. So yes, your company, the recruiting company that is sending you on assignment, is one form of support. The facility where you're going, whether it's a long-term facility, a hospital, or a clinic, they may offer some kind of support because you are under their, they're looking out for you, just as they do their own staff during the time that you're there. So ask questions about that. Talk to your recruiter, your hiring manager, or your supervisor when you arrive. Just say, are there any special meetings during COVID times that I can take part in, and give and take. Now, I did talk to one nurse a while ago who did work in New York during COVID, and she was delighted. I forget what state she came from. I feel like it was Virginia, so one of the southern states, but or maybe it was closer to the West Coast. But at any rate, this nurse had a couple of years of experience, and she decided that it was important for her to go and help. And there was a big need, and she went to New York, and she said it was wonderful working with the staff there. So it was hard. She was, I think she was working in the ER, and she worked very hard, but she felt it was very worthwhile, and made friends, and I think she roomed. So sometimes in the travel situation, you will get your own accommodations, private apartment or private housing, or sometimes you will, and that could affect, your pay scale as well. And sometimes you will have a roommate. But for her, it was a wonderful experience. She felt like she made lifelong friends, and they supported one another, just the team. Now, in some travel situations, that may not be the case. People may not receive you well. Let's see, there's another question here. Hi, what sorts of skills make a nurse unique and different from others? That's a great question, and I was going to get to that. One of the reasons that travelers, you need to sit quietly, little dog. One of the reasons travelers do well and are bringing up the HCAPs and so forth for the hospitals and the clients, and the response is so positive, is because they adhere to some special. Now, I'm not going to say every single travel nurse or every single staff nurse does everything perfectly every day, but there are some top, some special, I'm going to give you at least 5. Maybe I'll give you a couple more. Reasons why their performance, traveler performance or staff performance, why they make a difference, why the patient satisfaction is better, why they're happier with their care, feel more trusting of the healthcare workers and the hospitals. And it's so simple. It's so simple. But, as we were questioned, what do you do with the stress? You have to do something with the stress in order to keep this up. And I have wonderful friends, and they support me and I support them. So I'm a phone call away almost at any given time, unless I'm working. And And so you do need to know when you've kind of reached your limit, like my friends last week with, you know, surgical procedures and a funeral and so forth. They needed support. They didn't even have to ask for support. When I saw what they were going through, I go, this is what I'm going to do. I'm going to join you over here. I'm going to get this over there. I'm going to be there. Can I say a prayer? Can I do whatever? You know, you anticipate people's needs. So what great caregivers, what great travelers provide is, number one, simple. And I'll tell you on the other end, how damaging it can be if it's left out, is that you say the patient's name. You go in and you introduce yourself. When you start your work with your patient, you say, good morning, Mr. Smith. May I call you David if his name is David Smith? Would you like me to call you David? And he may say yes, or he may say, no, I prefer Mr. Smith. Okay, Mr. Smith, my name is Rita. I'm going to be your nurse today. Or my name is Rita King. You can call me Rita. I'll be your nurse today. I'll be here from this morning until 7 o'clock tonight. So we'll get to know each other. Right now, I'd like to look at your, you know, your wound, your IV, and so forth. And then we'll come back and we'll talk about the rest of the day. So you personalize your communication with that patient. You don't just say, hi, good morning, I need to check your IV. No, you use the patient's name, okay? You make eye contact. You don't just say, while you're looking at a chart, good morning, Mr. Smith, my name is Rita. I'm going to be your nurse today. No. Good morning, Mr. Smith. May I call you David? Oh, Mr. Smith is better? Okay. David, I'm going to be your nurse today, and you're looking them in the eye. And you're letting them know with your eyes that you care about them, that they are a person. So I'll tell you, the other side of this is that I had a nurse, wonderful nurse. I called her a Transcontinental Nurse because she worked for my per diem company for many years. But she also was a nurse in England and in a couple of different states. When she got here, I think she arrived on the East Coast, and then she eventually made her way to the West Coast, and still working today. Lovely, lovely lady, friend and nurse, but she was employed by me for quite some time. And she had a terrible accident. She rides bikes with a group of nurses and doctors, and there was rubbish. There was a soda can or something in the lane that she was traveling in at a pretty good speed on a fancy bike, and she had a terrible accident, hurt her face and so forth, and was immediately shipped to a trauma hospital. She did very, very well. She was an excellent patient. She looks beautiful. They fixed her teeth and her wounds and so forth. But she said when she hit the hospital after hitting the ground and was with professionals, you know, so she feels like maybe that was part of it. The fact that she was arriving with other doctors and nurses and that she was a professional herself. Maybe they were anxious to do everything so perfectly, but she said 3 or 4 nurses immediately came in. Nobody looked her in the eye. Nobody touched her hand or her shoulder. Nobody spoke to her. They spoke at her. And, you know, one was doing this and one was doing that. Somebody on that team should have looked her in the eye and said her name and said, we're here to help you. And I said, why do you think that happened? And she said, well, maybe because my husband is a doctor, because what? She says, but the real reason is that we become like automatons. They were so task-oriented, you know, cutting off the clothing, you know, managing the blood loss, evaluating, assessing, you know, her needs and wounds and so forth. And even if she couldn't talk, because she hurt her face and neck and whatever, head, whatever, and there's swelling, even if she couldn't speak, they could speak to her. Good morning, we're here to help you. We understand, don't try to talk, don't try to move. We're going to be checking. We're going to help you. The team is here. We'll let you know every step of the way. There may be some minor surgery, whatever, but talk to her, use her name, touch the person. So, and it's not the kind of nurse she is. She really is a wonderful nurse and very conscious of those things. And that's on my list of what makes a travel nurse or any caregiver, any professional healthcare worker special is one, understanding that you're dealing with a person and speak to that person and look them in the eye and do that as often as you can. Okay, spend time with the patient. Spend time with the patient. You're very busy, particularly in COVID. There's no doubt about it. In some departments, like we answered that question to Alex Books, some of the departments aren't there. The support departments, occupational and physical therapy cut back right now in some settings, and the hospital is one of them. It is temporary, but so your time is limited. But if you plan and if you become routine in your planning, you will have time for it. So you will. I'm thinking, I have to talk to some of my cohorts that are still active in the clinical settings. Is that you should and must have some patient education time, just not upon admitting somebody onto your unit or discharging somebody off your unit or home or wherever they're going after they're with you, is that there should be patient education and patient family education. And so you should schedule that. So if you're starting your day off with Mr. David Smith, say, Mr. Smith, I'm going to be your nurse today. And I do have to do some things right away. I have to assess your IV and your wound and so forth and your dressings. However, I would like later in the day, maybe after your lunch, or maybe I have a patient that I already scheduled a 1 o'clock time with, maybe around 1:15. I'll check with you again at 7 o'clock this morning, so we'll check again if there's a more opportune time. But I do want to give you some education about the meds you're taking and the meds you may be taking home with you. Whatever it is, patient education is important, and it isn't always going to be the right time for you. It may be just the right time for, it should be a good time for the patient as well. So if they traditionally have some special therapy going on in the morning, they may need to rest after lunch or before lunch, or, so take that into consideration. Try to plan with your patient and get some education. Some more people are checking in. What are the hardest part of being a nurse? Okay, that's going to vary from nurse to nurse, but I'll tell you what's the hard part on me. What has been the hardest part on me. And that's from Abu Tahar Sharkar. And, I'm not bilingual. I barely could do my English right. But I want to say, I know I had an Italian father or second generation and a Cuban mother, first generation. And in those languages, in some of those Latin languages, we pronounce every letter, right? So every letter is pronounced in the Italian language, in the English language. Well, the English, some things are silent. So I'm not sure if I'm butchering your name. I apologize. But Abu Tahar Shakar is saying, what are the hardest parts of being a nurse? Okay, we'll get to that. And then somebody here called Raman Farzana. Hello, I'm a nurse in an interview. How will I express myself? Can you please guide me in an interview? Oh yeah, that we could do a whole topic on that. Let's see how the time is going. We've got about 15 more minutes. We can talk about that a little. I'm going to talk to the first question. What's the hardest part of being a nurse? Okay, the hardest part of being a nurse, I want to say, one of the hardest parts is time management, okay? Because you are being pulled in a lot of directions. You have multiple patients, even in the ICU. You can have one-on-one or 2-to-1, or you may need to help another nurse. So you're being pulled in a lot of directions. In other areas of the hospital or the clinic, You're going to have multiple patients in the OR and the PACU, the post-operating room, post-acute PACU, post-acute care unit, recovery room. You're managing as people come out of surgery. So boom, boom, boom. You know, somebody comes out at 10, somebody comes out at 10:15, somebody's going in. You're doing pre-op and post-op. It depends on your team. It depends on where you're working. It's time management, and it can be really tricky. So you learn to prioritize and ask for help when you need it. Yeah, because if you're managing, let's just take a med-surg unit. You may have 4 to 6 patients, and somebody starts to have chest pain. Well, that puts everything off kilter, right? Everything goes off kilter. And so you want to say to a team member or to a charge nurse, I'm going to be in room 210 because my patient has chest pain. Can you pass meds for me in my other rooms? Or can you look in on my patients and tell them that I will be there, but I will be a few minutes late? So you allow yourself 15 minutes of concentrated time to see what's going on with that chest pain. Is it, do you need to give them nitroglycerin? Is it, can you determine whether or not if it's gastric? Do you need to call the doctor? Yes, you do. Are they on oxygen or do they need oxygen? What are their vital signs? You need to do some very rapid assessment of this chest pain, and you need to be by their side. It's not like you can call in. I thought somebody was hitting my window. I hope that's not a bird flying into my window. So the hardest part of being a nurse, I think for me, one of the challenges is time management and making sure that everybody gets what they need from you and that you provide them what is important in their care. Another thing, you know, the blood, the guts, the ups, the downs, you deal with that, you know, and you're professional. I mean, I've pounded on chest and, you know, stuck needles in all different places and so forth. That's not the hard part. That's the technical part. That's putting your knowledge and experience to use, and that feels good that you know what to do. I want to say one of the second hardest things is attitude, and I'll get more into that because that's one of the special skills, one of the special talents that a great travel nurse has, and that's on my list. So, so poor attitudes, whether it's coming from a doctor, a patient, a co-worker, a team member, another nurse, a bad attitude is tough. It's tough in any aspect of your life, but it can be particularly tough when you are, you know, you're facing the challenges of the job itself. So, so those are the two things at the top of my list that make nursing hard. There's a lot of beautiful things about nursing and being able to help people in their time of need. So it sort of outweighs those tough times. We'll get to attitude too. So I wanted to make sure I got through my list and gave you at least 5 things you're going to call your patient by name and be respectful. If they prefer to be called by their surname, use that. And then I'm going to get to the nurse that, or Miss, I think it's a Miss, for Farzana Rahman. I'm a nurse in an interview. How I'll express, give you some guidelines. I will give you some good guidelines for interviewing, but I want to get through this list of what makes a nurse above and beyond, and what helps in those HCAPs, those evaluation tools of patient satisfaction. And it is calling a patient by name, making eye contact, providing education for your patient, and being sensitive to what the patient is capable of. Like the person just came out of anesthesia. That's not a time to talk about what they need to learn or what happened during the procedure. No, they need to rest, they need to restore, they need to be more conscious, and so forth. Okay, ensure, do your part. You're not a housekeeper. I don't expect you to pull out a mop and start mopping or washing the walls, although Florence Nightingale did that. But tidy up, you know, particularly your patient with the chest pain. You're pulling drugs, you're calling the doctor, you're busy, you're pulling the chart. Things could get untidy. The patient may be, diaphoretic, and they have a lot of blankets on, and pillows are askew, you know, so you're throwing things out of the way. Patient comfort first, but be tidy. Ensure in the cleanliness of the hospital and the patient's room and the patient's bedside. As soon as you have a moment, or maybe this is a time to talk to a team member, you know, talk to one of the aides and so forth. If you see them taking a break, would you mind calling housekeeping for room 210? We just had an emergency in there. Things got, you know, kind of untidy, or something spilled, you know. You moved the bedside table away and things fell to the floor. You ask for help. It's part of your job as, you know, one of the top rungs in the team as a nurse to advocate for your patient. And cleanliness helps, you know. If you feel like the hospital's a big old mess, then you don't feel secure, you know, that you're going to get good care, because they don't even care about the room. Okay, so your attitude. Now we're going to talk about attitude. Your attitude is contagious. There's an old song that when you smile, the whole world smiles with you, but when you frown, you bring out the rain. So if you're having a hard time and you're grumpy, you be careful how you talk to people, because it affects how they feel and their outcomes. So a cheery attitude, particularly in the face of emergencies, and particularly in a acute situation, a good attitude goes a long way. A smile, a pat, you know. So you're in there with your patient with their chest pain, and the charge nurse just went and gave out your meds for 10 o'clock because chest pain happened right when you were going to pass some meds, and she comes in and she looks at you and you're still kind of like, you know, she can see the computer working. Okay, you've given nitroglycerin, you've waited, you've charted, you've called the doctor, they continue to be in pain, you give another nitro, and she sees you in this process and everything's rather acute, and she gives you a little, you know, rub by your shoulder or your neck, and she says, I medicated your patients, is there something I can do now? You know, and you might say, yes, whatever it is you need. Can you get me some towels? Whatever it is you need at that point. Can you get me a fresh oxygen mask? Whatever it is. So having that attitude of that helpfulness is fantastic. Having a bad attitude, you just have to, oh, Abu, the hardest parts of being a nurse. Oh, well, I hope that's helpful. I think other nurses might have other things that bother them more, but, you know, like not having supplies. If you're an ER nurse and you don't have the right supplies you need to start an IV, I mean, that's a disaster, you know. So, yeah, there are a couple little things, but I think top of the list would be time management for me personally, and attitudes. Yeah, they make a big difference in your workday and your humble experience of doing your job. But attitude, yeah, it's you want to leave things better than when you arrived, right? So a cheery attitude goes a long way. A smile goes a long way. Oh my gosh, when someone smiles at you, I have a grandbaby. When that baby smiles at me, all the pressure and aches and pains, they just go away. That baby's attitude is golden. So, so I want to say, if you've got a bad attitude, maybe talk to the person in charge, you know, and just say, you know, I'm just having a really tough time. Do you think I could take a break right now? And, you know, my patient was just yelling. He couldn't seem to speak in a civil tone. And I did the best I could. I got him everything I needed, but it didn't make a difference. He was just screaming at me. Or, maybe it was a coworker, that you tried to speak with them, and they walked away. They didn't even acknowledge you. And it just kind of really hit hard. It really brought you down. Maybe just take a break yourself. Get your cup of tea. Go out and see the sunshine, because when you're working in a facility, sometimes you don't know if it's raining or pouring or the sun is shining because you're doing your work. So really pay attention to your own attitude. Try to have a good attitude when working with others, and leave your troubles at the door. Come to work fresh, and it just goes such a long way. A good attitude is golden, just like that baby smile. What else do I want to say? Let's see. I'm a nurse. How will I express myself in an interview? Oh, okay. So, gosh, I've done whole episodes on this, and we could talk about this at length. We're just about out of time, so I'm just going to say, have a talk with yourself before you go to an interview. Of course, be well-groomed, right? Don't be wearing, animal skins and, tons of makeup and, just be conservative in your dress, slacks and a blouse or a simple dress, grays and blacks and whites, always sharp. So be well-groomed, your nails, your makeup, your hair. Don't be rushed. Give yourself plenty of time to get to your interview. And you know what you know, okay? You're interviewing, say, for a travel assignment, and you've already gotten all the paperwork and the documents. You and your recruiter have been working together for weeks, all your ducks in a row, and today's the day that you're going to meet the person in charge of the unit that you're going to be working on. And say it's an ICU unit. Just for giggles, let's say it's an ICU unit. So you know what you know. You know how to take care of patients. You know what kind of experience you've had with different disease processes, endocrine system and cardiac, and all the different systems that can break down, the biliary system. You know these things. You know your equipment. You have good rapport with patients and so forth. So in the interview, just try to be yourself. Be well-groomed. Give yourself plenty of time so you can have a couple of deep breaths. And I guess the biggest tip I can give you is to listen. Okay? And when the interviewer, they may tell you a little bit about their unit. They may tell you a little bit about the expectations. Save your questions to the end. Don't interrupt. But listen to the question and be specific and be kind of brief and succinct in your answer. If they want more, they'll say, oh, tell us more. Okay? So I can't think off the top of my head. It might be an ICU question. Oh, how many burn patients have you taken? Or have you taken care of any burn patients? And then you think a minute. Don't rush. And then you can answer, So if you were working in a medical ICU, the likelihood of you taking care of a burn patient is unlikely. If you came from a burn unit, then, critical burn unit, then you know an awful lot about it. But maybe say you came from a surgical ICU and you had step-down burn patients maybe, okay? Or maybe the hospital was awaiting a bed on a burn unit at another hospital. So you may have some experience with burn patients. So you can talk about that. So when the interview, you're going to work in an ICU, it's a surgical ICU, you have that background, and the interviewer asks you, tell me about your experience with burn patients. You can tell them. You can say, well, I have some experience. It's rather limited. Do you want me to tell you more about it? I took care of a patient that had, third-degree burns on both their arms. That's pretty critical, And she'd say, oh, well, what kind of medications or what kind of dressings did you use, and did you have baths and so forth. You know, she wants to know what your level is with that particular patient. Maybe she's anticipating. Maybe they have a burn patient in their unit right now. So my guidance to someone going in for an interview is to be well-groomed, to be as relaxed as you can. You can't help it. We're always nervous. Something new makes us nervous. So do whatever it is that makes you calm. Maybe it's washing your hands. Maybe it's deep breathing. Maybe it's having a cup of tea. Whatever it is, give yourself some time to relax yourself and be confident. You know, you wouldn't be there if you weren't a good candidate. You have the experience, and listen, and don't get too involved. Try to answer the question without expounding on it, because oftentimes the interviewer is somebody with a lot of responsibility and limited amount of time. It's good. What I try to do when I'm interviewing is let people know, okay, I'm all yours for the next 20 minutes or 30 minutes. We have plenty of time, so just relax. We're going to get through this, and save your questions for the end. Oftentimes when I've been the interviewer, not the person being interviewed, but the person doing the interview, I will often say, I'm sure you have some questions, and I'm going to give us some time for those questions. But first, let's just go through how this unit works, blah, blah, blah. I'd like to know a little bit more about your experience, you know. And oftentimes, this is something to be prepared for. And it's questions I often ask when I'm interviewing someone is, what do you think are your strongest qualities? And what do you think you need work with? Oh, it's my fan. It sounds like a little bird tapping on the window. So those two, be prepared to answer questions like that. What do you think is some of your strongest qualities? And what maybe are your weaker ones, or things that you feel you could improve on? Okay, and be honest, you know, I mean, none of us are perfect. My answer to that would be that I have really strong communication skills, and I can talk to pretty much anyone very well. My weaknesses might be that would hinder me in the hospital is that sometimes I tend to over-personalize. Like, it's good to be personable, to say, good morning, Mr. Smith. Do you mind if I call you David? That's being personable. But to tell David too much, say, about my grandchild or when my father was ill, maybe that's going too far. So I think I have to control myself from over-personalizing. So that would be something I'm always working on, you know, because I get friendly. I tend to be friendly, and that's fine. To be personable is good. To personalize too much, I have to be careful about. So that's how I would handle. Those are some guidelines for an interview. I guess I need to go. I've been here for about an hour. I will be back on Thursday. And thank you so much for everyone, for Alex and for Moleska Khatun and for Ayan Rahman and Abu Tahar Shakar and for Zana Rahman. And thank you all very much for checking in with the Travel Nurse channel. I hope that if you're considering travel, that these topics help you. And if you have traveled before, that you still find them interesting. And recruiters and hospitals and anybody that is looking for a travel nurse, please tune in. You can join the Travel Nurse channel, and we've got a phone number. You can contact me when I'm on live Tuesdays and Thursdays from 2 to 3 Pacific Standard Time, or you can call 800-737-6518 anytime, and you can email me, Rita@travelnursechannel.com. Thanks a lot. I'll see you Thursday. Have a great day.